Ainsley with her head-to-toe physical assessment for her final exam. The patient is a 33-year-old male, small business owner in construction. He's also married and the father of 2 young children. His vital signs are 126/73, pulse rate of 76, respiratory rate of 16, and temperature is 36.6. Skin is fair complected, even color tone. No signs of jaundice, erythema, or acne. Skin is warm, hydrated, no signs of flaking or skin trauma. Patient has a normal cephalic head, no lumps, indentations, signs of trauma. Hair is clean, well kept, no signs of infestation. Let me know if this bothers you when I touch you. Any pain?
No.
No pain on palpation of the sinuses. Eyes are symmetric, moist, clear, free of jaundice. Eyebrows and eyelids are normal and symmetric. I'm going to stand about 6 feet away from you. And with a cupped hand, I'm going to have you cover your left eye. And read the bottom row for me, please.
DEFPOTEC.
And switch hands again with the cupped eye. And read the bottom line right to left this time, please.
CETOPFED.
Patient has uncorrected vision of 20/20 and OD and OS. Pupils are 4 millimeters in diameter bilaterally. And shine a light in your eye. Pupils are equal and reactive to light. I'm going to have you cover up one of your eyes again with a cupped hand. And I will have you tell me when you visualize my finger coming into view.
See it.
And switch eyes. And again, let me know when you
See
see.
it.
Okay. Now only moving your eyes, keep your head still, and I'll have you follow my finger. Patient has intact peripheral vision and extraocular movement and muscle strength and tone intact. Sorry about that. I'm going to get really close and look into your eye now. Corneal reflex visualized. Stop moving your eye. Ocular disc and vessels visualized. External ears, exam reveals normal and appropriate size and appropriate placement on head. Skin is pink and warm, no obvious signs of drainage or discharge. Internal exam reveals visualization of the tympanic membrane, positive cerumen, though visualization of the tympanic membrane is not hindered. Tympanic membrane is a pearl gray in color, no bulging, redness, or signs of infection noted. External exam of the patient's nose is in the center of his face, midline, no signs of deformity. Lift your head up a little bit for me. Nasal mucosa is pink and intact, moist. Septum is midline with no deviation. And go ahead and open up your mouth. Open wide. And say ah. And fold down your lip for me. Oral mucosa is pink, moist. Tongue is midline and appropriate size for patient. Symmetrical rise of the patient's tongue and uvula when patient verbalizes the word ah. Patient is a smokeless tobacco user. No signs of ulcers, lesions, white spots, or any other indications of leukoplakia. Go ahead and open your mouth for me. And close. And one more time. And close. Any pain?
No.
No popping, grinding, or locking of the jaw when patient opens and closes his mouth. Okay. I'm going to attempt to palpate the patient's lymph nodes. Let me know if you feel anything that is tender to you. Any pain? Patient's lymph nodes are unable to be palpated, which is a normal finding. Palpating the patient's carotid artery. Strong and regular bilaterally. Trachea is midline without deviation. No JVD present. Auscultating for bruise over the patient's carotid arteries and jugular veins, and over his thyroid and parathyroid. Assessing the patient's thyroid and parathyroid. Go ahead and swallow. Does that hurt?
No.
Thyroid and parathyroid is not able to be palpated. No lumps, bumps, asymmetry, or goiters noted. And sit forward for me. Big deep breath in and out. Again. Symmetrical rise and fall bilaterally during the patient's respiratory cycles. Normal percussion of the patient's posterior chest. Go ahead and lean forward just a little bit more for me. I'm going to have you continuously repeat 99 for me. Go ahead. 99.
99.
Keep going.
99.
Keep going.
99. 99. 99. 99.
Okay, very good. Thank you. Normal vibration able to be felt on patient's posterior back. Lean forward one last time. Take some big deep breaths. Listen to your lungs. S sounds are clear and equal bilaterally. Let me know if this causes you any pain or discomfort. Any pain or discomfort?
No.
Patient reports 0 CVA tenderness. Go ahead and just breathe normally. Just listen to your heart. Normal S1, S2 heart sounds heard. No murmurs, gallops, or rubs. No extra heart sounds. So go ahead and sit up on the exam table for me, please. Oh, sorry, I'm gonna have you lay down. I'm gonna have you lay down. Sorry, I need you to go. Sorry, that was my fault. I'm trying not to break the table. Abdomen is flat, soft, non-distended, pink. A couple of minor scars noted from, is that from surgery or from accidents?
Accidents.
From accidents. Any sutures?
In this belly area?
In the belly area.
Negative.
No. Okay. Umbilicus is midline and inverted. Skin is warm and hydrated. Just going to listen to your bowel sounds. Patient has normal bowel sounds in all quadrants. Normal percussion throughout his abdomen. Light palpation, please let me know if this is causing you any discomfort. No lumps or masses noted on light palpation. I'm going to go a little bit deeper this time. Take a deep breath in. Blow it out. One more deep breath in. Blow it out. Any pain? Patient has no guarding, tenderness, or rigidity on deep palpation. The patient's liver has been identified and measures at 9.5 centimeters. Squeeze both of my hands. Push my hands away and pull them towards you. Good. A normal Babinski reflex for this patient. Swing your legs, swing your legs this way. Go ahead and just relax. I'm just going to assess your deep tendon reflexes.